Some of the growth that we've seen at Windmoor Healthcare really ebbs and flows with what the community needs. We have a variety of units. We're a 144-bed hospital, and our units are broken up based on acuity, right? So if we have a greater need for acute care beds, we're able to flex some of our units.
Welcome to Business Ninjas, brought to you by WriteForMe, where you'll hear from business leaders who are out there growing their business and slaying it every day. Learn from the masters. Let's get started.
Hey everybody, welcome back for another episode of Business Ninjas. I'm here today with Amanda Marker. She's a licensed mental health counselor and the director of business development at Windmoor Healthcare. Amanda, welcome to the show.
Good morning. Thank you for having me.
Yeah, excited to have you. So Amanda, why don't you start and just tell me a little bit about yourself?
Yeah, absolutely. I am a licensed mental health counselor, as you mentioned. I have been working in behavioral health for 14 years this year, a variety of different roles and different responsibilities, but always within the mental health realm. And I recently just started this position as the director of business development here at Windmoor Healthcare in Clearwater, Florida.
That's fantastic. So, that sounds like a great journey for you, kind of getting to Windmoor. Tell me a little bit more about the offerings of Windmoor Healthcare.
Yeah, absolutely. So Windmoor Healthcare is one of the largest freestanding private behavioral health hospitals here in Florida, and the only one actually in our county, Pinellas County, Florida. And we are an inpatient behavioral health hospital. We are open to Baker Act, which is the Florida version of an involuntary treatment act for individuals who are court-ordered for mental health treatment. But we also do have programs available for individuals who are voluntary, and we have a couple of different levels of care. So we do offer acute crisis stabilization for mental health. We offer detox and substance use treatment. We have a military unit completely designated and separate for our active duty veterans and our first responders. And then we also offer outpatient services. So we like to offer individuals, regardless of whatever level they're coming in at, our full continuum of care. So if somebody is inpatient with us, they will stay here for stabilization. Once they're ready, we really like to step them down to our partial hospitalization program. That allows them to have day programming Monday through Friday, 5 days a week. It's 5 hours of group a day. It's still intensive therapy and treatment, but they're home in the evenings, they're home in the weekends. And so that gives them a nice sort of soft handoff back into their daily life. If they're still struggling, if they're encountering, whatever stressors may be in their environment, we can be there the very next day to go, how did this go for you? How can we work on it? What are you noticing we need to really focus on moving forward? And then after our partial hospitalization program, we could then step it down again to an intensive outpatient program. And that is 3 days a week. And so then they're still home in the evenings, still home in the weekends, and then they have those other days during the week to really reintegrate into their daily routine. But it's really like a soft handoff back into that life to make sure that they have that structure and support when needed.
Do you think one of the ways that Windmoor is really able to stand out is that kind of scaling level of support? Because, for one, I don't hear a lot of, mental health facilities that have, units that are open to active, service members, which I think is fantastic. And then talking about those scaling down of, talking about the intense, crisis support, working your way down. Do you think those are some of the reasons, why Windmoor is able to stand out?
Absolutely. Absolutely. When people come to us and they need that highest level of care, that inpatient behavioral health or inpatient detox or inpatient crisis stabilization, that is a significant change. That's a very severe time for individuals where they need to come in and get stabilized. And it's life threatening, right? So these individuals are at risk of suicide, at risk of hurting someone else, severely actively psychotic, really unable to meaningfully care for themselves on a day-to-day basis. And so that's a major disruption in someone's life. Rather than having them here for treatment and stabilization and then just kind of opening the doors, we want to offer them that scaffolding where they're able to really get what they need and support, and then give us that feedback as well. When you're home, how are things going? and we can really individualize that treatment for that person as they reintegrate back into their life.
Mhm. I'm sure it's been interesting for you to see, with your time at Windmoor, how Windmoor has been able to grow and expand. And I imagine, too, kind of what makes it different is why you've been able to successfully kind of grow and expand, integrating all of these groups, talking about the different scaffolding levels of support. So, talk to me a little bit about that.
Yeah, so some of the growth that we've seen at Windmoor Healthcare, it really ebbs and flows with what the community needs. We have a variety of units. We're a 144-bed hospital, and our units are broken up based on acuity, right? So if we have a greater need for acute care beds, we're able to flex some of our units. We can, open another unit and accommodate for more crisis patients, or if we need to shift and allow for our substance use unit to, take on the larger unit. That's something that we can do. So we have that flexibility within this hospital to, like I said, ebb and flow with the community needs.
That's got to be really helpful to being able to adjust as needed to say, hey, maybe we're seeing an influx of, more substance abuse lately, or if it's around the holidays or things like that, there may be a more, tense time that requires that adjustment. So I imagine that that's got to be really helpful from your perspective. Also, being a licensed mental health counselor, having that knowledge of going into the job saying like, I know that the best interest of the clients is in the forefront of everyone's mind.
Absolutely. Absolutely. And one of the things that I've seen, we have now a second location. So we have our main hospital and our main facility in Clearwater. And we also have an outpatient in Tampa. So we have two locations. And one of the things that we do is we provide transportation for individuals to get to programming for outpatient. So for our partial hospitalization and our intensive outpatient. And having two locations really expands that area that we can help individuals get to programming and really reduce that barrier to treatment.
Yeah, no, I can't. That's got to be such a huge lift off of people's shoulders. Yeah, I think that's a fantastic service. I didn't know that you offered that, and I thank you for that.
Yeah, and that's the thing is we really want to make sure we're breaking down these barriers and identifying ways that people can get their needs met and the treatment that they are really needing and wanting in the best way possible. And if transportation is one of those issues and those barriers, we want to make sure we can take that away.
Yeah, no, that's huge. That's huge. So, kind of talking about different barriers, I know that there are a lot of common misconceptions within the mental health, the substance abuse, the trauma, the veterans affairs, kind of different, areas of expertise that you have. Talk to me about some common misconceptions that you often hear. Does it have to do with barriers? Does it have to do with stigma? Talk to me a little bit about that.
Yeah, I would say the one that comes to mind immediately is that people think that an inpatient hospitalization is going to be this really scary, terrifying thing, and they're going to be with individuals who are significantly more severe or acute than maybe what they're needing. And that's not the case. We've got different units for a reason, right? So individuals who are coming in who are potentially Baker acted or here involuntarily or acutely psychotic are not going to be the people that you're on the unit with if you're coming in and you are a working professional who is suicidal or are having some, first break psychosis. So, there are some checks and balances that we do to make sure that individuals are really with other like individuals experiencing the similar things. A lot of people are uncertain about how they feel about group therapy. And a lot of people don't understand the benefit of group therapy. And I absolutely love being able to promote it and talk about, yes, you're a group. It's not individual one-on-one therapy. And you get to really see how other people are experiencing this. And it helps feel less isolated and it really normalizes the experience. And people are able to share their experiences and share their strengths and share their tips that work for them. And there's a community that really gels and comes together when individuals are in treatment together. And then we also like to continue that on. So in our PHP and our IOP program, we also have an alumni program. So they meet once a month, and it's individuals who've gone through our program, who've had that fellowship and had that connection and come together, and they continue to learn mental health and substance use tips and check-ins, and it's really helpful.
Yeah, that's fantastic. And it sounds like the support, we've said it a few times now talking about that scaffolding, that you're really needing people at that layer or at the level that they're at for each point. You're talking about, those who have already graduated, the alumni. I think that's fantastic that you're still able to pull in that support and give, people who may be really not able to see the light or see, it coming to an end, just knowing that there's people out there that have done it, who have made it, and they've gone through it, and they can come back and talk about it.
Oh, and that's so beneficial. And one of the things that we like to do, especially with our military and veteran unit, I've got an individual who we work really closely with, who he himself not only is an alumni of our military program here at Windmoor Healthcare. He's a veteran himself. He comes in and he speaks and he says, "Look, this is my story. This is how it helped," and it's incredible to see that camaraderie and everyone support one another, and then they have that real life experience and get to understand, yeah, there is another side to this, or
Yeah.
there is a little bit of hope, and I think that's so important.
Yeah, I think that's fantastic. So, Amanda, if people wanted to go to learn more about Windmoor, the services that you offer, where would they go to learn more?
Absolutely. I would recommend our website to start, just windmore.com. It has all of our services listed, the insurances we accept, our program expectations, a little bit more in depth about what our inpatient substance use looks like, our inpatient military unit, our inpatient general psychiatric unit, and as well as our partial hospitalization and intensive outpatient program. And then one of the cool things about our website as well is that if you're somebody who's looking for outpatient services, so PHP or IOP, and anybody can start any level of care with us, if they're meeting the medical necessity. So they don't have to be inpatient and then step down. People can come in, from the community right into our partial program or right into our intensive outpatient program. But on our website, they can actually directly schedule an assessment for that.
Oh, that's brilliant. That's amazing. All right. Well, Amanda, this has been a great conversation. If there's anything that you want to leave our listeners with before we head out, either about Windmoor, about your role as the Director of Business Development, anything in mental health, anything you want to leave our listeners with?
One of the things that I continue to hear and come across in my life, and you see this on LinkedIn and social media, and it always says, sobriety is not the opposite of addiction. It's community, it's connection, and it's relationships. And I think that is so important for people to remember. And how you build that is, if you're going to join treatment, it's those connections that you make and those real vulnerable moments that you have when you're in treatment and when you allow yourself to experience and feel and grow. And so I just really encourage people that if you're considering services or considering treatment, give us a call and we're happy to discuss any sort of treatment options.
That's fantastic. Well, Amanda, this has been a fantastic conversation. I appreciate you really breaking down all of the different services that Windmoor offers, talking about stigmas in mental health, how you're able to pull in the community and really, really lean on them as another arm of the Windmoor healthcare system. I appreciate you being on Business Ninjas today.
Thank you so much for having me.